Hi, my friends. My name is Dr. Sayyeda Amna Mahmood. So, today I will start the topic about the Sheehan syndrome or the intrauterine adhesion, and we also say the uterine syncosis. So, what is the definition? The definition is the term used to describe the adhesions inside the uterus. Scarring can be mild with the thin scratch band of the scar tissue or more severe with the formation of the thick band. In the most severe cases, the partial or total occlusion of the destruction of inside the uterine cavity, like the destruction of destruct of the endometrial lining, causes injury in the endometrial line or the infection of the endometrium, which are damaged the inner wall or in to produce the scar tissue. Any procedure like the DNC, intrauterine adhesion, may form a DNC complications with the pregnancies and cause the uterine bleeding, abnormal uterine bleeding, and leads to cause the miscarriages. Sometimes the gynae patients also have the problem with the bleeding coming, like the dysmenorrhagia, menorrhagia, and with the infection like the endometriosis, and with the fibroids and some surgery like the previous cesarean section and the endometrial process like the ablations. So how can you have to rule out in ultrasound, which is our main topic? So you can find the irregular endometrium, some septations. You see the irregular endometrium, subseptations, and there is a mark of the increased vascularity, which I have shown in the another slide, and punch echogenic tissues in the endometrium, and the myometrial thickness. The endometrial thickness is less than 2 millimeter to you should be noted. So you see that this is the myometrial thickness is less than 2 millimeter, and this is the mass, which is look like a mass or the something which is adhesions. Pathophysiology of this syndrome is occurring due to the any trauma to remove of the basal layer of the endometrium, imposing the area with the uterine cavity. Such injury to the lining causing the inflammation allow the adhesive band to form the one side of the cavity to the another side. So this is the wall adhesions. One cavity is divided into the two. The abnormal in the placentation, where the placenta is forming, this is also the abnormal tissues is forming, which is called as a scarring or the scar or the band. The extent to the adhesions, sometimes the adhesions are extent, so this is the mild, moderate, and severe nature, and some are the thin and some are the thick, some like the spot like locations, and some like adhesion bands. So you always remember some are avascular and some are vascular, which is important for the treatment. Clinically, we can find the light spotting, irregular bleeding, patient have that sometimes normal periods, and the surface of the normal periods. Then you have the patients of the history with dysmenorrhea, adhesions, and some infertility with the recurrent miscarriages, which is the most important in history. And you have to see the poor endometrial side. So differential diagnosis about the related with clinical histories, which are the thyroid diseases, hypothalamic diseases, pituitary dysfunction, androgen dysfunctions, polycystic ovaries, inflammatory diseases, cervix or stenosis, and premature menopausal is also this have the findings. So you see the Doppler, so you have the high vascular, and this is the some band like appearance with irregular endometrium. This is the adhesion in the uterine cavity. So if this lady or this female are pregnant, what will be happen with adhesion? So adhesion will cause the room obstruct of the fetal, and which is lead to the miscarriages. This scar is also lead the high chance of placenta accreta, which you know the attachment of the uterine wall with the and have the high vascular, and which is very hard to remove and ends on the hysterectomy. placenta previa. This adhesions is also called the development of the placenta on the lower side, and which is harm for the baby to like the if it is normal deliver, and it is very pain, very difficult if you didn't diagnose the placenta previa, which grade of it, and it is a premature delivery cause. Excessive bleeding, just like the some are the trying to conceive but cannot be conceived. The conceive of the pregnancy will be recurrent miscarriages, infection lead to the ectopic pregnancy also. So then you have to be fine to the ectopic pregnancy. This adhesions is developed in the acentric pregnancy or the corneal pregnancy. Treatment, as this adhesions should be treated with the hysteroscopy to remove this scar, and then have to be clean the endometrium, and after this pre-operative and post-operative treatment to have the transdermal or the intramuscular estrogen you have to provide to prepare the endometrium for the conceive or the next period cycle, and to remove to reduce the size of the scar. Thank you so much, dear.